All right, hello and welcome to Spring 2025 application prep session. The intention behind today's meeting is to get you ready for the Spring 2025 application. Some things that we want to go over is some of the expectations within the nursing program. So the nursing program is 62 credits of a very rigorous curriculum, which also includes clinical. Your first 3 semesters, you are going to have one clinical 9 hours a week, and it can vary on various opportunities of where you'll be placed. We place you in clinical at a 45-minute radius to campus. And your first clinical is going to be more foundational, where you'll be focusing on bedside manner, proper hand washing, mobilizing patients. And typically that will take place at a nursing home or something of that nature. Your second clinical will be more of a medical surgical unit. Your first one in a hospital, where we will help you change bandages, ports, and trachs, and all that good stuff. Your third clinical is the clinical that you'll learn about the other half of nursing that actually is outside of a hospital. So that could be a juvenile or correctional facility. It could be a school. It could also be a health department. And then your last clinical, we strive to get you into a clinical that excites you. While it could be an ICU clinical, a labor delivery clinical, to name a couple examples, but that's when you'll be going to clinical 2 times a week. So roughly 18 hours a week, but that's not until your last clinical of your senior year. So with that being said, we have a lot of ways to help you be successful within our nursing program and handle the rigorous curriculum with our NLRC, which is the Nursing Learning Resource Center. I'm sure most of you know Ebony Cobb, and Ebony is a wonderful individual who helps with a lot of tutoring opportunities. And really, you should not be struggling in your classes alone. And we carry you through pre-nursing as well as through the professional major with those resources here on campus. The idea behind a nursing program is you're not going to walk out of these doors being the best RN in the world, but you are going to walk out these doors learning how to think critically like a nurse, behave like a nurse, and be able to apply the skills like a nurse. The rest will come as you progress in your career. When it comes to the time commitment of our program as well, we recommend students don't work more than 20 hours per week once you enter the professional major. And as you have known in pre-nursing, GPA is important. We want to ensure that you're going to be able to be eligible to apply to our professional program. And some of those requirements are going to be a 2.75 nursing GPA as well as a 2.75 science GPA. With those GPAs, it encompasses a few of the classes, which we'll cover in a few slides here, but we also hold true to a repeat policy. And the repeat policy you should have known or heard of at this point, but you will have no more than 2 repeats, and you cannot repeat each class more than 1 time. So, for example, if you went ahead and took anatomy and things did not go well, you then retook it and passed, that's great. That's your first repeat. Down the line, you took micro, and let's say things didn't go so well. You retook micro, you passed, great. That's your second repeat. But then things got a little funky come A&P2. At that time, you would then be ineligible for our program, as that would be your third repeat, and you would potentially have to go through an appeal process. On the other hand, the other example I like to use is, let's rewind back to that A&P1 class. And let's say you took it, didn't pass, and then you took it again and then didn't pass. At that time, you would fall ineligible for our program as well, breaking our repeat policy. For those people who just joined on, if there's any questions, please feel free to put them in the chat, and I'm happy to answer them as I go. For what's included within your GPA, you'll see all of these classes count as your nursing GPA. Then those 7 science classes count as your science GPA. Most of you have seen that curriculum change come through your emails these last couple days. I will be covering that in a momentarily. We are not going to include the genetics and genomics into the science GPA. However, that's going to leave you with still 5 points, but it's going to be out of 6 instead of out of 7. If there's questions, please, again, put them in the chat. But making sure you understand that all of these classes count as your science, or count as your pre-nursing GPA, and then we extract those science courses to get a better idea of where your skills are for your science classes. With the science classes, we are a STEM field, and we want to be able to ensure that you're going to be able to handle the rigor of our program. So rewinding back to that email most of you received earlier this week, talking about different changes within the program curriculum. If you're applying this upcoming spring, you're kind of, the way I like to put it, grandfathered in to some of our old ways. If you are going to plan to apply for the spring of 2026, well, then there will be different requirements. Some of those requirements are the medical terminology course. So if you are applying right now, the spring of 2025, you do not need to take medical terminology. If you have it, we can count it, but you will not necessarily need to take it for your application. However, spring of 2026, it will be mandatory. We are no longer requiring Nursing 102 or 251. Those classes have sunset. If you are enrolled in them for this summer, you will be hearing more soon, but they will not be required for the spring 2025 application. We are no longer requiring a history course. However, we do still strongly recommend it. Just as with the humanities class, we do recommend public speaking, but it is no longer going to be a full-on requirement. And we are no longer requiring the social science elective. These changes are a very exciting thing for us here because we want to be able to be more transferable, be more flexible with our students, and we actually also reduced the credit load to 120 from 124. So if you find yourself in this situation where you're no longer planning to take 102, 251, or your social science elective, you're really going to want to work closely with your advisor to ensure that you're going to reach that 120 credits that you need for graduation. At this point, I am anticipating most of you know how to calculate your GPA. If you look at the screen here, there's a really nice breakdown of how to go ahead and do it. Most of us use your pre-nursing worksheet to go ahead and calculate your GPA as well. I did the info session this morning. I was pleased to say many students brought it up, pulled it out, and was just kind of playing with their GPAs themselves. It's a great tool, but this is another way that you can go ahead and calculate your GPAs. I do see I have a question in the chat, and someone said, I'm taking medical terminology now from a previous college. Do I have to retake it at UWM? I'm going to have to see how that transfers in. Most likely, for a hunch, I want to say no, but without seeing the transcript, knowing the institution and the specific course number, we will have to verify, and that's a great question for your personal academic advisor. So to go ahead and start this spring, I'm very visual. So I love this timeline because it kind of forecasts and shows exactly how we expect progression to be. So students are in pre-nursing for typically 1 to 3 years, could even be a half in there, as I know some students maybe 2.5 or 3.5. But when it comes to pre-nursing, it depends if you're a transfer student. It's typically 2 years if you're on a 4-year plan, or 3 years if you're aiming towards a 5-year plan. But when it comes to the pre-nursing, that's where you are getting all of your leadership experience, your nursing and volunteer experience, and getting those pre-nursing courses completed. Then April, the application opens. The application is open now, which I'm excited and we will be covering shortly. And the application is due July 24th at 5 p.m. Say it with me, the July 24th, 5 p.m. So this is a very firm deadline. We want to ensure that you're going to be able to meet this deadline because there are no exceptions if you do miss this deadline. So you have from April until July 24th at 5 p.m. to submit your application. I also highly recommend not to put all of your hope in technology, and I truly would hope you'd have this submitted by mid-July as our recommendation. Then you're not going to hear from us that month of August. We are making sure that you are eligible, pulling transcripts, updating classes, and additionally, through that end of August, excuse me, we are going to ensure that you're doing well with your classes. For the coursework for your GPA, we will accept summer classes to calculate into your GPA as well. So if you are in a summer course, it's going to be very important for you to talk to your academic advisor to ensure that, one, we're going to get that grade if you're taking it at another institution like MATC, for example. So we're going to need that transcript, but additionally, give us a reminder that you are hoping to get that grade completed and it can positively impact your GPA. Or negatively, depending how you do. So then you'll hear from us most likely at the end of August to talk more about the application essay and interview. When it comes to the essay and interview, I'll be sharing those dates momentarily, but both happen within a 2-week time period in September, early September this year. Then you're not going to hear from us again. It's not us. We have to now grade and go through all of the wonderful applications, complete the essay interview review, as well as the essay review. And then come mid-October, you're going to find out if you were accepted, waitlisted, or denied. Whether you are accepted and or waitlisted, we are hoping then you'll attend the I'm in Now meeting come November, as at that point you would be able to accept your position in the program, whether it is in the program or on the wait list, and you would then learn more about the next set of requirements. As you would do clinical, there's immunizations, a background check, a ton of different things that we will clue you in on at that time that you'll need to get done. Then come January, you're going to have an orientation. You're going to come up to UW-Milwaukee. We provide you a nice little lunchy lunch, and we go over basically everything of the professional major and expectations within the clinical. You'll meet your clinical instructor as well, and it's a nice orientation to the professional program once you've made it that far. Then the next 2 years, you are going to complete the professional program. Then you'll take your NCLEX and become the best RN out there. If there's any questions, please continue to put them in the chat. At this time, told you I'm very visual, so I'm going to minimize my screen here and pull up the nursing website. So if you go into your Google bar and type in UW-Milwaukee School of Nursing, this is the website that most likely will come up. And I like to go ahead and back it up here so you can click on professional major. Once you go ahead and click on professional major, there's a lot of resources on this tab. One of the things I really want to make sure to highlight in resource are some of this resources tab right here. And if you scroll right here, you'll see that there's a UWM School of Nursing core values. These core values are very important. I highly recommend you read about them, know them, live by them, and can think of examples on how you showcase them in your life. As if you can do that, this will make your interview, your application, and everything a little bit easier on you. You can find the recording for today's session. It'll be updated right here as well. So if you want to go ahead and go back, this is a great tab for you to familiarize yourself with. But let's flip back to this apply tab so I can show you a couple other things while we're here. A little website tour. We're going to click on this application guidelines first. What I recommend is downloading this to your computer and saving it as to your computer so you can actually go ahead and type your application within this. I can't recommend it enough for you to save your application and actually start it in a Microsoft Word document so you can save, continue, and go. Once you go into our application, there's not going to be an opportunity to save and come back later. You're going to be expected to complete it and submit it. So this gives you the opportunity to not only save what you completed, but also allow you to come back with fresh eyes to review it and make edits. And then also, whenever I'm going up for a job interview or something, I like to reread what I put on my application. So you can reread this before your interview or so on and so forth. So more information dates are up here. You're going to see that this general data, some of this lingo is just how it is on our application, but this is a nice template for you to kind of get started and use. There's also some exceptional examples on how we would like you to input this information. So for example, the classes that you need to complete before you can start the professional major, because remember, all pre-nursing classes must be completed by you start the professional major. But you would like to put them in like this. This is the highly recommended way that we'd like to see it. So this individual needs to take nutrition at UW-Milwaukee in winter of 2022. So any fall classes that you're planning to take, any summer classes that you're planning to take or finish up that aren't completed by the time you're applying would be a great example to put in here. There's some tips, and then you'll see that you have a little bit of a blurb on how you would go ahead and enter this. This is our security question. So you're going to go ahead and type in SON for School of Nursing twice. And that is our security, as if you were to click all the traffic lights or all the cars, just how we do those in shopping online or something like that. But we just want to ensure that we're not getting blasted with spam on our application. So recommend downloading this, saving this, copying and pasting it into a Word document, whatever is your protocol. But this would be a great place to start. Flipping back to this website, I also want to pull up the rubric right from here, because the rubric is in my PowerPoint, which we'll gloss over in a moment, but I also want to show you how easy and accessible it is for you as well. So when you go ahead and pull up the rubric, most of this you should have seen. I like to give this to students right on day one so you know what you're messing with. But you'll see that our holistic application is 50% quantitative and 50% qualitative. If you ask me, I'm biased, I work for this program, but we don't have any entrance testing. There's no TEAS test, there's no HESI testing, but we use this as our metric, as our base, a holistic application process. When you apply to the application, and submit your application, we're not going to have your name. It's going to capture a badge number. And the badge number is another way that we practice this holistic approach, where we ensure that you are going to go through this process without people knowing who you are, knowing your last name. It's very unbiased. So we try to do that intentionally. The first half is grades. As I mentioned, we are a STEM field. We have to ensure you're going to be able to handle the next step and rigor of the professional program. So the reason your advisors are always saying a 3.3 or higher is what we deem as competitive, and it's because that's how you're going to get the most points. So as you can see, the breakdown for the science GPA as well as for the pre-nursing GPA. When it comes to the science courses completed, we are going to be looking at if you have 5 of the 6 classes completed by the time of application. If you do, you'll get your 5 points. If you have a repeat, you will see that you lose a few points here. But I want you to know that you're not out of the game yet. Still apply. As long as you're eligible, apply. I cannot stress that enough because you never know what the application pool will look like. It changes every year. Then when you go to the qualitative data, you'll be looking at different aspects as well. You'll see that your in-person writing sample as well as your virtual interview do make a difference, as well as the life, work, volunteer, and leadership experience. When we go to the application, you'll see that you have a 400-word limit for each one of those components. So for life and work, you're going to have 400 words. For volunteer, you're going to have 400 words. And for leadership, you're going to have 400 words. And ideally, we would like to see 3 things for each section. I always tell my students that you have stuff that you should be sharing that may just seem as part of your normal life. If you are first generation college student, that's something to definitely mention in your application. If you have family expectations that are maybe not the normal or the average, that sets you apart. So definitely connect with your advisor and bounce ideas off of individuals who may have applied to see like what are things that you could put on your application. And I'm happy to connect with you as well. So to flip back to the website, I'm going to now click on apply to the professional major. And again, as you can see, this is all right here, right on our webpage, right underneath apply. So now when I click apply to professional major, this is the application. The application is bright yellow or gold, I mean, for Milwaukee, but it looks very similar just as that handout did. So you're going to go ahead and start entering this information. Some of this information you can select prefer not to answer, but the reason we do ask for it is as we do US News Report, there's different types of things where we want to capture our population for our program. As you scroll down, it'll look very familiar. The previous sheet had examples of how we would like your personal information laid in here. And then this is where you'll have that 400-word limit. By doing it in Microsoft Word, you'll have a better idea for spell check as well as word count. So I really recommend that as well. And then you will see right here the SON for our security. For life and work and experience, things that I always recommend students to put in here can be of course, your job, any job that you've held in college. If you have multiple siblings or younger siblings that you help take care of, definitely mention that. If you're a parent, these are all things that can go and are worthy of going in this life work experience. Volunteer experience. Yes, we're looking for up to 3 options. That could be being a part of this nursing association here on campus. That could be something with your church. A lot of people kind of forget about that church aspect as it's just part of your life, but that is considered volunteer experience. And additionally, leadership. A great example I like to use is if you're working at Taco Bell and you become a shift lead, that's fantastic. Put that on here. If you I had a girl this morning who trains people at her dialysis clinic. She is a trainer. Put that on here. All of that stuff sets you apart and it really showcases who you are and what kind of type of person you are as well. I do see I have a question in the chat that I want to hit. I had a repeat pharmacology to my last school. Does that count as a repeat at UWM? Will that result into losing points? No. So pharmacology comes in as elective credit here at UW-Milwaukee, so it would not count against you here in this program. The only classes that will count as a repeat are the pre-nursing courses here. Let me go back to my PowerPoint. So these are the only classes that would count as a repeat. And I also want to clarify that let's say you took A&P 1 and you passed it with a C, but you wanted to retake it for a better grade. That's not going to count against you as a repeat. The only time a repeat will count is if it is a C- or lower. Great question. So, any questions about this online application right now? We recommend using Firefox for the reason of just avoiding any computer issues if possible. All right. Someone in the chat want to put when it's due so I know you're listening, so I know life is there. Oh, wait a second. Anyone? Hey, yes, July 24th. Thank you. You are listening. Thank you. So I did pull this up on the website because I do think that there is a nice part of being able to see it and access it on your own, but that's not in the PowerPoint. But if there's any questions about this, please, please, please let me know. But it is pretty self-explanatory. And again, when it comes to the interview and essay, there's not really a way to prep per se. But for the writing sample, what I recommend is, we're looking for ensuring that you're going to be able to critically think, knowing the mission and values, kind of really reiterating what you've learned in Nursing 101. And just taking that knowledge and being ready for a question. We aren't going to ask you a question like, oh, 98-year-old woman fell down the stairs. What do I do? That's not a question we're going to ask. We don't expect you to be a nurse before you're a nurse. But it is going to be a question that may be layered, and there's going to be multiple components to it. So understand that even with the interview component, it's going to be kind to know those mission and values. And a way that I prep for the interview is, think of an example where you showcased integrity. Think of an example where you showcased compassion. I think understanding and having a good example on deck could help you prep in a way for something like this. So I see I have another question. Can you tell us some more leadership experience example besides training at work? Yeah, so fellow advisor Holly put in some great options, but yeah, student org on campus. So if you're part of a board on the student org or have some sort of campus position or leadership opportunity, that would be great. If you organized a mitten drive, I have a student whose parents own an ice cream shop and she organized a mitten drive once. So I thought that was kind of a unique way to go about it. But any way that you've showcased some sort of leadership, maybe at work, you redid a policy or you implemented a new way to sign up for overtime or something of that nature. Students do get creative and it a lot of the time works because it's not that way of thinking. So definitely feel free to connect with me and we can talk to after I stop the recording and everything, and we could probably pull something out. So these dates are why you are here. And the interview is September 10th through the 12th. How this works is at the end of August, Robin Jens, who I'm sure you're familiar with that name here at UW-Milwaukee, will send out a sign-up genius. And the sign-up genius will be a first come, first served type of basis. It's going to be through email, and it's going to be sent to everyone who is eligible into the program. So everyone gets this email at the same time. Once you go ahead and get this email, you can click on the sign up genius and sign up for the time that works best for you. What I recommend doing is just making sure you kind of blank off the calendar for this. If you typically work these days, you'll definitely want to put that notice into work. But these are our interview times, and I'm hoping that these will work for you since we are talking about them all the way in April. When it comes to the interview questions, as I mentioned before, you'll be asked 3 questions by 2 to 3 interviewers worth 5 points each. So now with the writing sample, that is going to be Saturday, September 14th, and that's going to be in person here in Cunningham Hall. And more information will be sent out around this date closer to, but today the main takeaway is to have this date, screenshot this date, put it in your calendar, request off, do what you have to do to be there, because this is the best time for you. If you need an accommodation, emailing us your advisor today would be acceptable, but otherwise we are planning to see you here. Next but not least is I'm excited to talk about the numbers. So here at UW-Milwaukee, we accept 80 students every spring, and we waitlist roughly 20, and then we will deny the rest. The reason that we would deny individuals is because we don't want to give false hope. We want to ensure that if you are waitlisted, there will be a potential for you to get off of the wait list. If you are waitlisted, though, it is going to be very important for you to abide by and follow through with everything as if you were to be accepted. So you would have to go ahead and complete the requirements just as if you were accepted to be ready to be pulled off of the wait list. I also want to provide a Waukesha update. Earlier this week, there was an email that went out about UWM at Waukesha. And as a cohort, we typically have accepted 32 students. We are still planning to go forward with accepting a cohort out at Waukesha. However, it would be for those individuals who were at Waukesha, and they would complete their first semester at Waukesha and then come to UW-Milwaukee to complete the following 3 semesters. From my understanding with this, we would keep them as a cohort here at UW-Milwaukee, and then they will move forward kind of a little bit separate than the UW-Milwaukee group. Any questions about that? All right. So once you go ahead and complete getting your acceptance letter, application, interview, all that stuff is completed, you're going to get your acceptance letter. And then in early November, we're going to have the I'm in Now What meeting. We just completed this for our fall students last week on campus, and it's an exciting time where we do a deeper dive into what requirements are needed for you to go ahead and start the professional program. We dabble and connect about viewpoints. We talk about the background checks and drug screening, and additional immunizations that you may need. If you are waitlisted, we want to ensure that it's going to be the right decision for you to accept your place on the wait list. So you would want to connect with your advisor before you go ahead and accept your place on the wait list. We can develop a plan, and something I always encourage students to discuss is, what is your parallel plan? If you're applying to the program and you don't get accepted, what is your plan? And that's, if you don't have an answer, that is a-okay, but I will tell you right now, it is much easier to come up with a plan before you need to enact a plan. So I would encourage you to talk to your academic advisor, whether it be in the next month, a little later this summer, maybe June, July, but it would be very smart for you to connect about, if I don't get accepted, what are my options? What am I planning to do? With the nursing program, there's a lot of costs associated with it. So we always like to talk about this as soon as you are considering. Things to anticipate are additional fees when it comes to differential tuition. Differential tuition is just over $30 additional per credit, and those fees go to items like your white coat. They also go to help with additional fees for the Black and Gold Committee that can decide on how they want to share those fees with you, whether it's an ATI help or a textbook help. There's that going to be associated. Ordering a uniform through Gloria K, that is something that happens at the I'm in Now What meeting, and having a uniform with the UW-Milwaukee insignia on it in Galaxy Blue with correct clinical shoes, all of that will cost a little bit extra money. But a lot of these items are going to be like first semester items. They're not going to be something you don't need to buy a new uniform every semester. But we do recommend to have at least one good uniform, having a stethoscope with some fun either tubing or engraved so it doesn't walk away. And then you will also get a badge. Things to also anticipate are getting your CPR certification. So if you work at a healthcare facility and you do get this, as long as it's BLS provider and American Heart Association, that is A-OK and you can use that. But you want to ensure that it's not going to expire by the end of your clinical or mid-clinical. So that's where things could get a little hairy that we can definitely talk about in that I'm in Now What meeting in a few months. And ensuring you're familiar with the deadlines. November 1st is a popular deadline, and then January 1st. It's going to be very important for you to not miss these deadlines, as if you miss these deadlines, you do risk losing your position in the program. So, what questions do you have for me? Again, I am the Parkside Nursing Advisor. Katie Knack is back from maternity leave, and she is in office very soon. And Holly Radke is the Waukesha advisor. And we're all here to help you, guide you, and answer anything that you may need. I'm going to go ahead and stop recording right now so we can have some additional dialogue if you would like.